for the CDC, for the mask mandate, reversing the mask mandate for vaccinated individuals, I would actually say it's about time. Vaccinated individuals are extremely low risk for the most part, and we're also very low risk to other people. So I think it needed to happen. I think it's a good incentive for people to get vaccinated, to find out that they can, kind of get rid of their masks. I will point out that they did put some very specific caveats in there. When you're in high risk situations, you should still wear a mask. I think that's very appropriate. As for the governor, I will admit I gasped out loud when I was listening to his news conference the other day. I was shocked. I've heard some people say that money could be put to better use, and I don't necessarily disagree with that. I know there's a lot of people struggling right now, but honestly, if it incentivizes more people to get vaccinated so we can get closer to herd immunity, I'll take it, whatever.
Dr. Margolis, what do you think? What's your perspective?
Yeah, so the CDC, I would say they evolved the mask recommendation, and it's really, we are here. It's May 2021, and we know so much more than we did 2 months ago. So many more people have gotten a chance to be vaccinated, and so yes, this was going to happen. We were going to reach a place where fewer people needed to wear masks, and so that's where we're getting to. As far as the lottery for the vaccine, I think it's creative. It's drawing attention. I hope that it draws the right kind of attention, and whatever it takes to help people get to that place where they decide to get vaccinated. We'll be there when they're ready to make the decision.
Dr. Englund, the governor is lifting all of our health orders in 3 weeks. Is it too soon, or is it just the right time?
Oh, well, I think as with anything with this virus, time will tell. I think that once the CDC has obviously talked about us not having to wear masks any longer if you're vaccinated, since there's no way to really tell who's vaccinated and who's not vaccinated, people are not going to be wearing masks, even if they're unvaccinated. There are some people who are going to choose to do that anyway. So to limit some people to wearing masks if they feel like it and others not, I think it was time to probably stop putting those restrictions on board. Now, that doesn't mean that people shouldn't still use common sense, but I think it was just going to devolve into people not wearing masks anyway.
All the heads were nodding when you mentioned the 2 words, my favorite words, common sense. All right, Dr. Margolis, you're our only gentleman here, aside from Dino, who's going to be answering questions and asking questions with me. Dino DeNatale, I'm sorry, I didn't introduce you right off the bat. This is Dino. He is our digital producer for WKYC. He is my partner in crime this evening, and he will be asking questions of our doctors and monitoring our text line and seeing if any other questions come in live, and we'll let you know that way too. So if you have any questions, feel free to reach out to us. All right, Dr. Margolis, I'm going to start with you. How long do you need to wait after you get the COVID vaccine to get other vaccines such as pneumonia or shingles or even a flu vaccine?
So great news there. That recommendation changed yesterday. And so you do not have to wait. You can get both all the vaccines at once. And the reason is because same thing. We know more than we did a few months ago, and it's okay to get vaccines together. It doesn't cause any harm.
All right, Dr. Gibson, I'm going to jump to you. I've heard from a lot of parents asking this particular question. I'm worried about the vaccine causing infertility in my child, or I've heard from women who may be having trouble getting pregnant. They're worried about getting the vaccine, thinking that it may cause infertility or pregnancy issues.
Yeah, this has become a really common question. I mostly take care of pregnant women, so they're not asking, but they're asking for their friends. And the good news is that there is no scientific evidence or theoretical evidence why this would be the case. There's actually been women in some of the vaccine studies who have gotten pregnant in the study, showing they certainly have no problem with fertility. And we have been reassuring patients that this is not something they should be concerned about.
All right, Dino, take it away.
All right, let's shift over to Dr. Amy Edwards. And question now goes to the kids. Why do kids need to get the vaccine if they only get mild cases of COVID?
Well, that's a great question. And the answer is because it's twofold. One, kids can still spread COVID, so we need them to be part of the solution. And two, some kids do get severe COVID. It is less common than adults, but we've had kids in the hospital. We've had kids in the ICU. I've had kids on ventilators for a month or more at a time from COVID. So there are some cases, and they're impossible to predict, where kids have severe COVID. So it's best not to take that risk and just go ahead and get your kid vaccinated.
And meanwhile, Dr. Hoyen, will my child have a strong reaction to the second dose, similar to a majority of adults?
I think that they probably will. In terms of strong reaction, again, the reaction to the COVID vaccine really has been very similar to what we see when people get their yearly flu shots. So the things that you might expect after the second vaccine is redness to the arm, as well as there have been some reported fevers in kids, body aches, sometimes a little bit of mild upset in your stomach, as well as some diarrhea. So really those same things that the adults are seeing, I think we probably will see them in the children as well.
Dr. Englund, do I need the vaccine if I had COVID? And what do you say to those who say they would rather get the virus than get the vaccine?
Absolutely, we need to have everybody get vaccinated, even those who have had COVID. You know, we picture of the immune system after somebody has had a natural case of COVID, so we don't know how long that immunity is going to last. And what we've seen from other infections is that actually the vaccination does a better job of having your immune system respond to it as natural infection. So it's important for everybody to get vaccinated because there's also variants that are out there, and we want to make sure that even if you had one type of COVID, that you're protected against other variants. So if they would rather get COVID than get the vaccine, I think we've already heard from some of my colleagues here that we see devastating cases of COVID in our intensive care units, and people are still dying. 600 people just yesterday died of COVID in this country. So it is a devastating disease, and a shot in the arm and feeling poorly for a day or two is much better than actually getting COVID.
Dr. Isaac, Dr. Margolis just told us some great news that yesterday those guidelines have changed about when you can get your COVID vaccine, and when you're also looking to get another vaccine. But when we're dealing with kids and the kids, the typical vaccines kids need, will this vaccine interact with any others that they're scheduled to receive?
So just like with the adults, it should not interact with any of the other vaccines that they receive. We expect it's not a live vaccine. We expect there to be no interactions with any of their regular vaccinations that they should continue to get and get on time.
Dino, go ahead.
All right, back up top here to Dr. Margolis. How safe are vaccines for immunocompromised people? And what's the longest amount of time you can wait between the first and the second Pfizer vaccine for it to still be effective? So it's like a two-part question there.
That's a two-part question, sure. So it is safe for people who are immunosuppressed to get the vaccine. It may not work as well, depending on how immunosuppressed the person is, but it is safe. For the second part, the Pfizer vaccine, the second Pfizer dose should be 21 days after the first, but there really is no tail limit beyond that. I mean, ideally you'd get it 21 days, maybe a few days later, but folks have gotten it up to 6 months later and been fine.
I'll take this next one with Dr. Gibson. Does the vaccine impact menstrual cycles in women?
Yes, so there has been some anecdotal reports of women having slightly heavier periods right after getting the vaccine, but after that going back to their regular cycles. So I would encourage you, if you got the vaccine, you can sign up for VSafe and report if you think you are having a different period so that we can learn more about that. But long term, there does not seem to be any effect.
Dr. Edwards, we've heard of these long hauler symptoms with adults, but now we're hearing them with kids. What are kids experiencing?
Well, what kids are experiencing is actually very similar to what adults are experiencing. So I've seen kids come in, who never had headaches before. Suddenly now they have migraine syndromes, chronic abdominal pain, chronic low-grade fevers, like 99, 100, that sort of stuff, fatigue, dizziness, confusion, short-term memory loss, all the same sorts of things. most of my kids are milder than what my adult colleagues are telling me, but I have had some teenagers who for weeks at a time can hardly get out of bed. The fatigue is so bad.
For Dr. Hoyen, should children 12 to 15 who have type 1 diabetes get the Pfizer vaccine? And what are the risks for somebody with that kind of a condition?
Really, all of the vaccines are safe for people, even with people with chronic illnesses, as we've heard. Even immunocompromised people can get any of the vaccines. For kids with diabetes, it's really actually more important that they, take good care of their health and do things like get vaccinated. They are relatively, can at times be slightly immunocompromised, as well as their diabetes can lead to other health conditions, and they can sometimes be a little more fragile when they're ill in terms of their diabetes. So it's really important that all kids, especially those kids with chronic diseases, are getting their vaccine on time. And
for Dr. England, what's on the horizon for booster shots? And do they have to be the same brand as the first two I received? Like, I got the Pfizer. Do I have to get a Pfizer booster shot down the road? And where will I be able to get that? Or where will I get that when that time does come?
Well, I think it looks like we're all going to need to get boosters at some point in time. The question is when. Is it going to be something that rolls out that we get a flu shot and a COVID shot in the fall? It's likely to happen, especially as we see more variants. We're going to need to get some updated versions of the vaccine. They're looking at studies now to see if even with the first and second doses of the vaccine, if it can be intermixed between the pharmaceutical companies. So we're just starting to get that information out now. So we don't have any idea yet if you're going to be able to get a booster from a separate pharmaceutical company. So more information to come on that. And certainly my hopes are that as we start to get into the time frame of boosters, you're going to be getting that at your doctor's office or at your local pharmacy. We're not going to have the mass vaccination sites like we're doing now.
Dr. Isaac, is giving the vaccine to my daughter with autism safe? Were there any trials done on children who have or are in the autism spectrum?
So in the trials that have been done, there have been individuals included with disabilities, but I don't think with the trials they delineate, how many people may or may not have had autism, but certainly in people with disabilities, it's been proven to be safe. So I think in children with on the spectrum with autism and other intellectual disabilities or things like that, it's perfectly safe for them to get it. And actually probably in some cases they may be at a little bit higher risk because if they have other caretakers that are involved with their care, being in sort of groups of other individuals, either like with group schools or homes or things like that, they could be at slightly higher risk. And oftentimes kids with other disabilities have other underlying medical conditions that can also put them at high risk. So it's still a good idea to get vaccinated even with autism.
Dr. Margolis, will the Pfizer vaccine help if a person who has COVID starts to develop blood clots?
It would help prevent future blood clots from another COVID infection. So if someone gets blood clots in the setting of an infection, you got to do everything you can to make sure that you don't get another COVID infection, because you'd be just as likely to get new clots. So it won't help with those current blood clots, but we know how to treat that, but it will help keep you safe in the future.
And I'll take this next one with Dr. Gibson as well. Is the vaccine safe for pregnant women?
This is the most common question I get every day. And while pregnant women were not included in the original studies done on any of the vaccines, since that time, tens of thousands of pregnant patients have been vaccinated in this country. They've used that V-Safe registry, so we have their data, and we have enough safety data that the FDA has now recommended vaccine for pregnant patients. We know that they do not have any higher risk of side effects than anyone who's not pregnant, and most of those effects are just a sore arm, feeling a little bit under the weather for a few days, but long term, not only are they protected, but their babies are also protected because we know that they pass along those protective antibodies to the newborns.
Dino, go ahead.
Yeah, let's head to Dr. Edwards. I'm assuming this question has to do with variants, but this is I'll read the question word for word. How many kids got the strange COVID illness locally?
I'm actually wondering if they're thinking about MIS-C, the multisystem inflammatory syndrome for children.
Yes, I think they are.
Yeah, I think that's what it's
Yeah.
referenced. So in Cleveland, I don't have the exact numbers because I'm only seeing the ones who come to UH. We're following at Rainbow, we're following about 30 children who had multisystem inflammatory syndrome in children. I would assume Cleveland Clinic is probably somewhere in that same range. I know Metro's had a handful as well. Statewide, we're looking at about 170 to 180 children who have had MIS-C. Nationwide, I think it's something like 35 children have died and some thousands have had it. So it's uncommon. It's about 1% of kids who get COVID get MIS-C, but it's nasty when you get it.
See, I learned something. I learned MIS-C. I love it. We're gonna learn some more. Here's for Dr. Hoyen. The question is, as a cancer patient undergoing intensive bi-monthly chemotherapy, I've been told that the chemo drugs might inhibit my ability to develop antibodies. I'm also told that I'm immunocompromised by the treatments, making me more vulnerable to the virus. Thoughts on that?
Exactly. It's we've touched on this a little bit, but the way that the cancer drugs will make you not be able to respond as well is because they're typically inhibiting some of your immune cells. So they're fighting whatever cancer needs to fight. Sometimes the immune cells get in the way of the chemo and have problems themselves as a side effect of the chemo. And so again, as this person has said, that they are relatively immunocompromised. So again, this is really someone that I would recommend talk to their oncologist and figure out when the best time is to perhaps get the vaccine. I know that at Rainbow and at Seidman Cancer Hospital, we are absolutely encouraging and helping our patients get the vaccine when, as I said, after you've spoken with your physician to figure out when it might be a good time for you to do that during your treatment, but certainly going ahead and getting that done so that if you can develop some immunity, you will have some.
Dr. England, I'm going to combine a couple of questions here. So this one came in. My husband and I were diagnosed with the virus in April. How long should we wait to get the vaccine? And then another person said that they also had the virus. They got their first dose of the COVID vaccine, got very, very, very sick, and their doctors told them they didn't need the second dose. So let's start with the first one. How long should somebody wait to get the COVID vaccine if they've had the virus?
So if you've had the virus, and this couple back in April had it, as soon as you're out of your quarantine period, which is about 10 days now, you should be you are eligible to get the vaccine at that point in time. We used to talk about the potential for being protected about 90 days once you've had your infection, but I think even that time frame is not clear. So as soon as you're out of quarantine, you can apply to get your vaccine, and I would suggest that you get it as soon as one is available for you. So the second question, my apologies. If they received the monoclonal antibodies for treatment for their infection with COVID, then they do need to wait 90 days. So that's the newest 90-day time frame. So if you had monoclonal antibodies, and you would know it's an infusion, so your doctors would have told you about that, then you need to wait 90 days because otherwise you won't get a decent response to the vaccine.
And tying into that, yeah, the person had COVID 6 weeks later, got her first COVID vaccine, got very, very sick from it, and then was told she didn't need a second. Is she going to need one down the
No,
road?
we really do need to complete the entire series once you've had it. So even if you've had COVID, I had COVID. And when I had my first vaccine, absolutely, that one was the most response that I had. So after the first vaccine, I had a lot of arthralgias and felt pretty cruddy for 2 days. Went ahead and got the second vaccine and felt fine. Didn't feel anything after the second vaccine. So if you've had COVID before, you're going to have your most robust response after that first vaccine, where most people who haven't had it will get a stronger response after their second vaccine. But finish it. Absolutely finish the entire process, because, you know, if you only get one vaccine, it's really only about 50 to 60% effective.
Dr. Isaac, this has been such a huge issue among kids, and, you know, a lot of mental health issues we all know from virtual learning and everything else, the isolation. My teen has been anxious amid the pandemic. When do I need to seek help?
So, I mean, if you're really noticing significant changes in behavior with your children, teenagers in particular. So if they're sleeping more, if they're more irritable, if school performance is declining, those are all good reasons. Or if you're just concerned, you can always talk to their primary care provider, and they can certainly do some screenings and get them pointed in the right direction. I know we've been seeing a lot of teens affected with mental health issues related to the pandemic. So it's pretty important to check in with your kids.
Dino?
All right, Dr. Margolis, there's an extreme amount of misinformation, go figure, on the internet, including but not limited to RFID tracers in vaccines. Can you comment on that problem, and also maybe just the problems of misinformation? Because, I mean, I've just noticed people tonight, as we're doing this show, are struggling with what to believe.
Yeah, so I think we've gone through a lot this year, and it's been just incredibly trying time for people to find their grounding as so much has changed. And people are hungry for information, and there's a lot of information out there. And some of us are lucky enough to have trusted friends who are in the field, who are public health professionals, who are physician scientists, and some of us aren't. And so when I hear that, we just gotta withhold our judgment and, help people and build that trust and help people get the right information. But, this is a vaccine developed by some incredible teams of scientists, and we're so lucky to be in this world where 95% effective, which I imagine none of us thought would be possible. And so grateful for the dialogue around it, but I hope people will find people they trust with good information.
Dr. Gibson, what trimester should a pregnant woman get the vaccine?
Whatever trimester they're in and they're eligible to get the vaccine is when I would recommend it. With that being said, I do have some patients, especially in the first trimester, who are a little more hesitant. So I encourage them to have everyone around them get vaccinated, kind of cocoon themselves with individuals who are vaccinated. And then maybe when they're in the second or third trimester and feel more comfortable, to get vaccinated at that time. The key is not only for that pregnant patient, but for everyone around them, so that we can get the entire community vaccinated.
For Dr. Edwards, can a fully vaccinated person be a carrier of this virus and potentially infect a non-vaccinated person?
So that's a really great question. And the answer is yes, but not easily. So there is some data coming out. There's several small studies that have been done, and we're waiting on a couple of bigger studies to finish, that show that while a vaccinated individual can carry the virus and spread it to other people, it's at much, much lower levels than what an unvaccinated person would have. The amount of virus, what we call the viral load, is much, much lower. And viral load matters, numbers matter. And so with that lower load, it's harder for me to get people sick. Thus, the newer recommendations for vaccinated people not to worry about masks quite as much, because it's much harder for us to get other people sick.
And for Dr. Hoyen, what side effects would be considered to be too extreme after that second dose of the vaccine? And when would it be necessary to go see your doctor or a clinician after that? This person who asked this question says they got Pfizer Part 2 back on April 24th.
Typically, the most serious reaction that we worry about from the vaccine is an allergic reaction. And those people typically have that reaction if they're going to, and it's been very few people, to be honest with you. I think there have only been one or possibly two people who have become ill within that 15-minute or 30-minute waiting period that you do after you receive your vaccine. So that's really going to be the most critical time. And that's why when you get the vaccine, people are having you stay and they're watching you to be sure that there aren't any side effects like that. Really, the only other thing that I've seen where people have had to actually go to a physician, like we said, most of the side effects are kind of like a mild case of the flu. And last maybe 1 to 2 days. So not a lot of chance there that you're going to end up in a doctor's office. I have seen one person who their vaccine site was bothering them a lot. And so they were doing kind of some scratching and touching, and that area became infected. So that might be something. If for some reason the redness in your arm seems out of proportion, or it seems to be spreading, you're having, a fever or something like that, you may just want to give your doctor a call. And so I've had maybe one patient that in the tens of thousands that we vaccinated where I've known that has happened. So again, the side effects are really very minimal. And so hopefully, if people understand that, they won't be as scared as they might be. So again, really not a lot of reasons to go to the doctor. The biggest one is usually right after the shot, and that's why they keep people there to keep them safe.
Dr. Hoyen, can you also cover the fact that, there's lymph node swelling, and a lot of people get really concerned about that? Yeah, exactly. That was really one of the first things that I heard after we started our mass vaccine clinics at UH. And people were texting me pictures of underarms and all sorts of things. And so we realized that this shot really seems to be causing what we call lymphadenopathy, or exactly those lymph nodes, kind of where the drainage is from your arms in the lymph system. Some of those nodes are getting overexcited because of all the things that are going on because of the vaccine. Is there a particular time though that if that's happening to you, and how long does that last? Yeah, I think time that most people that I've been talking to, it's been lasting at least like 4 weeks for some people. If for some reason you have a lymph node and it continues to get bigger, where it just might appear and then usually they stay pretty static. If for some reason it's growing, you're developing other symptoms like a fever or something like that. But really, if it's still there after a couple of weeks, maybe a month, I would just call your physician just to be sure there isn't anything else you need to be worried about. But again, I don't know of many people that have ended up in the doctor's office for it. It's annoying, and some people have said it is uncomfortable, but it's a good sign for you to let you know your immune system is doing what it should. Dr. Englund, how do we know this vaccine won't give us cancer or some other new disease down the road?
Well, I think we need to put vaccines in general in perspective. When you look at, say, the early 1900s, before we ever had any vaccines, and the number of deaths in the world that were going on because of vaccine preventable diseases. Now we look at the vaccines that we currently have, and the fact that we don't see polio, we very rarely see measles. So many things that killed hundreds of thousands of people before, we can now prevent. So we do have a lot of vaccines that we are giving our children and we are giving our adults. So we have a lot of experience with vaccines. And if there are going to be side effects and problems with the vaccines. They're generally seen within 2 weeks, at the latest 2 months. So we don't have any vaccine that you're going to be seeing problems arising, decades later. And again, we've had vaccines since the 1940s. So we don't have any history of any vaccines causing cancer down the line. So it's really unlikely that this one is going to be having any problems as well.
Dr. Isaac, what's the vaccine hesitancy rate among the patients that you're seeing? And of those families of color, what are you telling them? What is the message that they need to understand?
Yeah, well, thank you for that question. So I've actually been very surprised at how many families have been asking about getting COVID vaccines for their kids, even before we got to this point where the age limits had gone down and it's been available for kids 12 and older. So that's actually been pleasantly reassuring, but I definitely have seen those that have been hesitant. And, we just have an honest conversation about what we've been talking about here. And frankly, a lot of the higher risks happen to be in populations of color. And so really to help with the rest of your family, other family members that may be at higher risk, it's really important to think about getting your kids vaccinated. And we just talk about all of the things that we've been talking about thus far, and hopefully help them be able to make a decision about getting vaccinated. But I did, all of my family did, and we're standing strong. So get vaccinated.
Dr. Margolis, somebody wrote here, the process of getting these vaccines and getting them out into the public, it seemed rushed. In your opinion, were they studied long enough and really vetted hard enough before being made available?
Yeah, I would say it seems fast, right? And I think I remember when Dr. Fauci first said, possibly by the end of 2020, we'd have vaccines. And that did seem fast. Two things that really helped make that happen. One is there were teams of scientists ready to go, ready to test vaccines for coronaviruses specifically, because the common cold was from different types of coronaviruses, so they were ready to go. The second thing, unfortunately, is that there was so much of coronavirus SARS-CoV-2 in the community at the time that the vaccine was tested, that it was pretty quickly clear which folks in the study had the placebo compared to which folks had the real vaccine. And so, never, in 100 years have we had that much of this infection that we were, had this huge opportunity essentially to make this vaccine during this time. And so that's what led to it being ready so quickly.
Can you also talk about the fact that never in our time, at least not in my lifetime, I've ever seen governments pour billions of dollars into research. We had people getting involved. I mean, this was a global emergency pandemic. Is that another reason why this research was done so quickly and got to market, if you will, so quickly?
Yes, you said it.
And also, I've had a number of people talk to me about the fact that they're concerned that this only received emergency use authorization. These are not FDA approved. What's the difference and why does it matter?
It's a timeline question. And so we are still in the first 6 months or so since this vaccine received the emergency use authorization. Formal approval takes longer, 6 to 12 months longer. And so we will get there. It's just going to take longer. And they do that because they want to continue to watch, how people do. But we'll get there shortly, I imagine.
And I would guess emergency use is meant for an emergency, which
this felt like an emergency for sure. Yeah.
Dr. Gibson, what does the vaccine do to the baby? Well, it protects the baby. By mom making the antibodies when they get the vaccine, then those antibodies cross through the placenta Similar to other vaccines we use in pregnancy, we recommend the flu shot, we recommend the tetanus booster. This is the same. It protects the patient, and then it protects the baby after delivery so that the baby is safer out in the world where there's still COVID going around.
For Dr. Edwards, if vaccinated people can still get COVID, can they still get damage to their internal organs? Is there any information regarding vaccinated people who contract COVID presenting with damage to their lungs or any other organ that you're aware of?
Yeah, so that's a really great question. So I'm going to answer it two different ways. One is, yes, it is possible for people who get vaccinated to get COVID. We know that the vaccine is not 100% protection. It's very, very good protection. 95% of people who get vaccinated won't get COVID. The majority of people who get COVID will get mild COVID or even asymptomatic COVID, but there have been what we call these breakthrough cases, people who are vaccinated who have a breakthrough infection. There will be people with breakthrough infections who are severe. Most of those are going to be in people who had a poor response to the vaccine. So what we've seen at UH is the majority of the people who are coming to the hospital with COVID are unvaccinated, but the small percentage of people who are vaccinated are people who were immune compromised, so the vaccine didn't take very well, or very, very elderly who have what we call immune senescence, meaning their immune system isn't as good as when you're younger. And so the vaccine just didn't provide 100% protection for them. And yes, some of those do have organ damage. That is why it's important for all of us to get vaccinated, because the vaccine isn't going to work in everybody. And so for those of us who have stronger immune systems and the vaccine will work, if we all get vaccinated, then we can help protect those who don't respond as well to the vaccine.
For Dr. Hoyen, as we keep going here on our vaccine town hall, how has the pandemic shaped school health programs and schools' relationships with the hospital partners?
Yeah, we've had, and I know that the clinic and Metro interface with the schools at UH. We work with a team from PSI that provides hundreds of school nurses throughout Northeast Ohio to different school systems. So we've always, as healthcare systems, partnered with the children and at the schools. But this really was something different. At UH, we, realized once the governor, kind of opened things back up last spring, that there might be a chance to get kids back in school in the fall. And we had started later in the spring, early in the summer, working with businesses, because we realized as a hospital, we never closed down during the pandemic. And so we figured out how to do a lot of things to keep people safe. And so we actually created a playbook for businesses, which we took out to the community. And we realized, like by late May, early June, that we probably needed to do that very same thing for schools. And so at at Rainbow, we developed a playbook. I probably went to 40 different schools in Northeast Ohio, and toured the schools and talked to the administrators. I've done tons of webinars in the evening with teachers from all around Northeast Ohio. Because remember, our teachers went back, a lot of them went back before teachers or children were vaccinated. And I can say, really proud of the work that we did, and really proud of the teachers and students in Northeast Ohio who did go back to school in the fall and successfully stayed in until we had that big surge in the winter. So I think it really has altered our relationship with the schools in a great way. That we are currently partnering with the Cleveland Metropolitan School District, and the kids will be going on a field trip to go get their vaccines at our center out at the MSC. And we have clinics for the kids as well. One this Saturday, the clinic of, I think, 1,200 kids is already full for the 12 to 15-year-olds. So again, it's really great to be working closely with the schools. Like I said, I have some of those principals and people at from the school districts on speed dial. And actually, I will be giving a commencement ceremony from a school that asked me because I had spent so much time with them this year. So again, I think it's a great way for us to now have these relationships with the schools, to realize that we are their partner in caring for the kids, and whatever we can all do together is really best for the children.
Dr. England, I have the questions about the vaccine card for you. So this person says, my J&J vaccine card has an expiration date. My sister had Pfizer and it doesn't. Is this the expiration of the shot's effectiveness or the expiration of the vial the vaccine came in?
Typically, when we have an expiration date that is put on any kind of a vaccine record, that's the date of the vial. So the vial is good until that date. So we just want to make sure that we're not giving anybody an exposed or an expired vial. How long is this going to last? I don't know. So we certainly cannot put any kind of an expiration date on how long our immunity is going to last.
So it's not you who's expiring, or the
correct,
because you got the vaccine.
It's the vaccine.
Here's another one. When I was vaccinated at the Wolstein Center, the Army National Guard did the vaccination, gave me a paper card. Is that the only record of my vaccination? Is there a central database somewhere? And should I give a copy to my doctor?
So I would definitely say give a copy of the vaccine to your doctor, just to make sure. It's very important that we have those recorded. From what I understand, everything that was done at the mass vaccination site, that has also been recorded so that it is available for all of us, all of those who were vaccinated down at Wolstein, to be included in the lotto that's going to be coming out. So you shouldn't have to worry about getting yourself re-registered for that. You can win that $1 million as well. So that should be in a database from a public health standpoint and from the state standpoint, but it may not have been sent to your own personal doctor. So make sure you communicate that information to your own physician.
And that website info for the state, more information on the lottery, is supposed to come out next week. So I know it's going to crash about 5 seconds after it hits, but hey, if it makes more people get a vaccine, more power to them. Dr. Isaac, what do I do if I'm terrified of needles?
Oh, that's a good question. Well, we have a lot of different ways of dealing with needle phobias, especially in a pediatric clinic. So oftentimes there can be certain medications that we can actually apply in the area. Though those things take time. We also have child life services that can help with distraction techniques and things like that while someone's getting a vaccine. Most of the kids I see are older, and so typically it just takes a nice strong hug from a parent and we get through it. And I think most of the time kids really worry about like the length of the needle and the size of the needle, and really it doesn't matter, because once it goes, it's just the part that's going through the skin. So once that happens, everything else is fine. And that's less than a second. And our nurses are fantastic, do this all day. So really trying to distract yourself and get through it and know that this is a good thing, and we'll get through. But definitely talk to your doctor and they can help with that.
Take me to my happy place and don't look.
Exactly.
That's it.
All right, Dino, go ahead.
Dr. Margolius, I was told I should not get the vaccine due to a severe reaction to contrast, shellfish, penicillin. Will there be a vaccine eventually that would work for these people?
So the current vaccines, all three of them work for you. Fortunately, even if you have allergies to these other things, this vaccine is safe, and we'll make sure that we're right there in the worst case scenario if something were to happen. But you're safe. You can get the vaccine.
That's good. I have a shellfish allergy, and I was fine. So
just stay away from shellfish would be my recommendation.
That's right.
I want to throw in there, Dr. Margolis, we had another question. If you're allergic to CAT scan dye and have reaction from nuclear stress test injections, can you still get the vaccine?
You still can. Yep, you're safe.
Good to know. Dr. Gibson, should we wait until mammogram appointments are done before we get vaccinated?
Yeah, that's a great question. I'm going to go back to Dr. Hoy and her overexcited lymph nodes. So when you get the vaccine and you get some patients will get that swelling in their lymph nodes, we recommend that you either get your mammogram before your vaccine, or if you've gotten your vaccine, that you wait about 4 to 6 weeks for those lymph nodes to go down so that you don't get any false positive results on your mammogram.
All right, Dr. Edwards, this is one, I mean, I've seen it about 5 times tonight. We've got a bunch of people asking about this. I'm fully vaccinated. My neighbor, however, refuses to get a vaccine. How safe will I be walking into a store without a mask with potentially unvaccinated people?
You will be very safe. The vaccines that we have are extremely effective. I heard somebody earlier tonight say about how lucky we were, and we are. If you look internationally at the performance of some of the other vaccines, I'm thinking particularly of like Sinopharm, the ones that we have here, Pfizer, Moderna, and Johnson & Johnson, have been performing exceedingly way beyond my wildest expectations. So if you are vaccinated and your immune system is relatively normal, I know there's some immunocompromised people who maybe are getting less protection from the vaccine, but the vast majority of us have excellent protection from the vaccine. And so while yes, you should encourage your neighbor to get vaccinated, you are protected.
Here's one for Dr. Hoyen, and this is a good shout out, I think, for the clinics. Can kids sign up / walk in to Pfizer clinics?
The parents would need to probably help the kid because you need parental consent to get the vaccine. So I know that the governor has said that if children are going with their school to a vaccine clinic, that they don't need their parent there as long as they have that proof of consent. And again, the people who are bringing them, from the school are going to know who they are. Right now, anyone who is a child who's under 18 is going to need to have their parent there with them.
And I want to throw in something too, and doctors jump in on this, and I haven't seen yet, it may have already happened, but 12-year-olds need a prescription to go to a pharmacy. However, this will be a moot point as soon as the governor signs a bill that is on his way to his desk, and hopefully by now he's already signed it. Is that the message you're getting as well?
Right.
Okay.
Yes, I've already prescribed the COVID shot for a couple of my 12-year-olds.
Right, but actually, if you're coming to this vaccine you don't need that pharmacist's prescription or your physician's prescription. So if you're going to bring your 12-year-old to a mass vaccine clinic like that, there does not need to be any sort of prescription from the physician. Right. So there are still ways, even tomorrow, for you to get your child vaccinated around Saturday without needing to have your physician write a prescription.
Absolutely. It was only regarding pharmacies, and within a matter of hopefully hours, that will no longer be an issue.
Won't be an issue, right?
Dr. England, we have one about corticosteroid knee injections within a few days of a COVID vaccine. Will it affect the immune response?
When corticosteroids are injected into an enclosed space like a knee, there really shouldn't be much of a systemic uptake of that steroid. So you should be pretty comfortable with being able to get a vaccine within a few days of that. And you should still be able to get a fully robust response from that. So I don't want anybody to have any reason for delaying the vaccine any more than they should. So please take that opportunity and go ahead and get vaccinated.
And on those same lines, Dr. Margolis, I'll bring you into this. I know there was a study done with people with blood cancers and having a lower immune response. What do those people need to be aware of? Anything more specific?
Just as we've said earlier, that if your immune system isn't as strong, the vaccine might not protect you as well, but it won't cause you harm, and it's still definitely the right thing to do to get it to protect you.
All right, I cannot believe we've managed to get through quite a few viewer questions, and I want to thank everybody for submitting them, and thank you with all of my heart for answering them, because I simply can't. I just listen to the experts and, you know, say what you guys tell me. But what I'd like to do is kind of do a round robin here, and your final thoughts, what you want people to take home, and especially for those, we know there's probably, especially relating to kids, for those of you who in pediatrics, we know there's about a third of parents who can't wait to get their kids vaccinated. There's another third sitting on the fence, and then there's another third who are like, absolutely not. So let's talk to those 2/3. Dr. Isaac, I'll start with you. What do you want them to know?
That the vaccine is safe. And as we said earlier, we've been worried about the mental health of our kids. We've been wanting to get back to socialization, playing sports. This is the best thing we have and the best way to be able to do it. So we should get vaccinated.
Dr. Edwards, what are your thoughts?
My thoughts, if you're a parent sitting on the fence, what I will tell you is I'm vaccinating my own children. It's safe, it's effective, you should do it.
Dr. Hoyen?
And again, my children have also been vaccinated. My 18-year-old took it upon herself. She was so excited to get vaccinated that she actually stalked multiple Rite Aids before the 18-year-olds were allowed to get their shots, because she and her friends would get the shots, you know, the leftover shots at the end of the day if somebody didn't show up. So, you know, there are children who are excited to get this because it's getting them back to normal. It's so important for them. It's so important for all of us, but especially the kids. This has been so hard on them and so hard to understand. And it's, you know, they need to be with each other. They're all growing, they're learning, and that's how they grow and learn, by being with their peers. So I hope that parents understand with this vaccine, the science was not compromised. The timeline was compressed, but the science wasn't compromised. These are amazing vaccines, and we just hope that you understand how excited we are for you and your children to be able to take this next step, so that we can all get back to the lives we had before, and we can move the kids forward and get them back in school with their friends, really just, you know, like it used to be.
And maybe have a chance to get a 4-year scholarship somewhere too. You know? You never know. Dr. Gibson,
there could be that too. We'll take it.
Dr. Gibson, is there anything you would love to make sure women who are trying to get pregnant or pregnant women be aware of? Is there anything we didn't ask you that you want to make sure they understand about the vaccine?
You know, what I tell my patients is that we've spent the last, 15 months wearing a mask, being afraid for good reason of this virus, right? I've had pregnant women intubated in an ICU without their family around them. I do not want that to happen to another patient. And now we have a tool to prevent that. We have a tool to get back to normal, to go to the grocery store without a mask on, to travel and see your family. It's just 1 shot or 2 shots, but it's the key to getting our world back. And so I would encourage every patient to do it. My whole family's been vaccinated, and I hope that yours will too.
Dr. Margolis, what would you like people to remember? And is there anything that you keep getting asked that I forgot to ask you?
No, you asked them all. This was a great conversation. I think I would just add one additional thing is just kindness. Folks are going to be in different places of their journey with coronavirus, with masking, with indoors, with outdoors. So be kind, don't judge. You know, if you see someone wearing a mask and they're vaccinated and they're outside, they're still allowed to wear the mask, and just be kind.
Dr. Englund, I'll let you have the final say here.
Oh, I couldn't agree more with Dr. Margolius's comments. I think this is a very rapid moving field, and we're making new recommendations, and some people are comfortable and some people aren't. And I think and I also don't know what somebody else's health status is. So I don't know if they're immunocompromised or living with somebody who's older that they're concerned about. So I'm not throwing away my masks, and I don't expect anybody will. We also don't know what the fall will bring. Do everything that you can to protect yourselves and your loved ones. For those people who say that they don't need to worry about it, they're young, they're healthy, they're not going to get sick. You know what? You may end up in our long COVID clinics here. That's not something that people want to do, but you may not get hospitalized, but you could be living with the after effects of that for months to come. So protect yourself as best you can. Keep wearing those masks if that's what makes you comfortable and makes you feel safe. But first and foremost, get your vaccine.
And those masks will come in handy in cold and flu season too. So, you know, we managed to get through that one. I have one more question that just came in, and this one kind of pertains to me. I'm a brain tumor survivor. I'm still living with a brain tumor. And this individual said she's a 20+ year survivor, but she wants to know, is there a specific vaccine she should get? I got the Pfizer vaccine, had no issues. Is there anything, from what I'm hearing from all of you, they're pretty much all the same. So pick one, right? I'm getting the thumbs up. Okay.
Whatever is the fastest you can get it. Whatever is available.
Great advice. Again, thank you all. I know this is not going to be our last town hall, but we are 3 weeks closer to somewhat normal, you know, and I love, I am not a doctor. I don't play one on TV. I just have the ability to talk to very, very smart people. And the only thing I will prescribe with you is common sense. So I hope everyone takes that to heart and they actually use common sense when they're in the situations. I think after 15 months, we all pretty much know the rules and we all pretty much know what the risks are. So I can't thank you all enough. I'm going to let you all go. And for everybody watching at home, thank you so much for joining us. If you want more information, please make sure you go to WKYC's vaccine page. Everything you need to know. Believe me, we've been scouring everywhere. And of course, most of these doctors are quoted in a lot of our articles. So feel free to get your information from there. Also go to the CDC, check out the FDA, check out MetroHealth's website, the Cleveland Clinic website, and also UH. They all have great sections on vaccine awareness and what you need to know, as well as how to get an appointment. Thanks, everyone. Have a great night. All right. So Dino, if you could have whomever just.
Yeah, I'm making arrangements with him right now. So just stand by.
Okay.
But
you guys.
Thank you.
Great job, Dino and Monica.
You guys are awesome.
Thanks for including us. Bye.
I'll send you links to everything so you can share them on your social.